When a disc between your vertebrae bulges from its normal position, it is said to be herniated. Other names for a herniated disc are a slip disc, a ruptured disc, or a prolapsed disc. The discs most likely to herniate are the lumbar discs of the lower back. Often this causes pain in the hips, buttocks, or legs known as sciatica. Discs can fail in many ways. Sometimes the disc bulges but doesn't actually rip or tear. Other times the outer layer ruptures and the soft material inside leaks out, causing pressure, irritation, and swelling in nearby tissues and nerves. And sometimes a disc ruptures and a piece of the outer layer breaks free and floats into the channel where the spinal cord runs, which can be very painful and lead to more serious complications. The symptoms of a herniated disc often start with an episode or repeating episodes of low back pain. The pain varies depending on which nerves are affected. Often the sciatic nerves, which are the largest and longest nerves in the body, are affected. Pain from an affected sciatic nerve is called sciatica, and it usually is sharp and radiating through the hip, buttocks, and legs. Symptoms often get worse when sitting or standing, and may be somewhat better when lying down. If the sciatic nerve is severely compressed, there may be numbness, tingling, or muscle weakness in the leg. Sometimes there is a temporary or permanent loss of normal reflexes in the knee or ankle. In rare cases, nerves to the bladder and bowel are impaired. If you find it hard to control urination or bowel movements, call your doctor. As painful as a herniated disc can be, the condition often improves with rest, mild exercises, and the use of minor painkillers. Progress can be slow, however. It may take months before you feel relief. If you have had a herniated disc, you're at increased risk of having another, so you'll need to talk to your doctor about ways to prevent further problems. Conventional X-rays can help a physician determine if back pain is due to a problem with bone. X-rays are an invisible form of energy that can pass through soft materials but not solid ones. Thus, X-rays can show the vertebrae of the spine well, but cannot show much about the muscles, tendons, ligaments, and intervertebral discs that are often involved in a back problem. X-rays are painless, though you will be asked to remain still while an image is taken, and this may or may not be uncomfortable. X-ray images are developed within minutes, so your doctor will be able to explain the results shortly after they are taken. The radiation levels used in today's X-ray machines are extremely safe. However, women who are pregnant should consult their physician prior to any X-ray examinations. A discectomy is the surgical removal of a portion of an intervertebral disc. It may be used anywhere in the spine to relieve pressure from a herniated or damaged disc. Discectomies are performed under general anesthesia. The standard approach is for the patient to be positioned on the operating table in a kneeling position. An incision is made along the spine at the site of the problem. Less commonly, the patient is positioned face up, and an abdominal incision is used to reach the interior surface of the spine. After the incision is made, supportive tissues are pulled back to expose the disc. The disc and any parts that may have ruptured is scraped away. Many new techniques, such as microdiscectomy, percutaneous lumbar discectomy, endoscopic discectomy, and laser discectomy, reduce the time you spend in the hospital and speed recovery. After surgery, you will be moved to a recovery area where you are monitored while the anesthesia wears off. When you wake, you may have a urinary catheter in place, which is a tube inserted into your urethra to drain urine into a bag. You may also have a sore throat from the tube used to help you breathe during the surgery. Initially, you may find it difficult to speak, or you may slur your words. This usually wears off fairly quickly. You may be fitted with a spinal brace or a corset to help stabilize your back. Your doctor or therapist will tell you the length of time you'll need to wear the brace or corset and also give you the specific instructions on its use. On either the day of surgery or the first day after surgery, you'll get out of bed. This helps keep blood circulating and helps to clear your lungs. You can usually begin taking showers 1 to 2 days after surgery. You may feel more pain than normal after your operation, or you may have dramatic relief from pain, especially if pressure on a nerve root has been corrected. During your hospital stay, pain medication will be available from either a nurse or from patient-controlled analgesia, sometimes called PCA, which allows you to give yourself doses of pain medication when you feel you need it. As soon as you can pass urine and move around safely, you will be able to go home. Your doctor will prescribe oral painkillers that you can take as needed. Recovery time varies with the type of procedure done. You will need to restrict bending, lifting, or weight-bearing activities for a few days, a few weeks, or a few months. Ask your surgeon what you should and should not do, and if there are any symptoms or warning signs you need to report.